Hello, we are Domino Health Solutions, and the product that we are presenting today is the Notorious RGB. Our team is Mikaela Hatfield, that's me, and Amelia Ikuta, Carlie, Rein, and Erik Halsband. The mission statement of our company, Domino Health Solutions, is to provide innovative products for the enhancement of the life experience through biomedical engineering applications, product design, and cutting-edge technology. So the problem that this device, Notorious RGB, addresses is color blindness. So what is color blindness? It is a genetic defect on the X chromosome. This is a sex-linked condition that inhibits the patient from accurately perceiving color light through their eyes. There is no current cure. It affects about 7% of the male population and 0.5% of the female population, and over 250 million people worldwide are affected by color blindness. In the image on the right, you can see that the top left wheel is a complete rainbow for those with normal color vision. However, patients experiencing deuteranopia, protanopia, or tritanopia, which are the three most common conditions that are colloquially known as color blindness, they are obviously very different than the rainbow image that is shown in normal vision. So our product is Notorious RGB, a color corrective contact lens. It is a filter on red and green light for patients with photoreceptive deficiencies. The product is intended for everyday use, and our first release will be on red-green color blindness or deuteranopia. However, this technology should be translatable to other types of color blindness as well by simply applying a different dye. So the competitors in our market, currently there are no retailers in the contact lens space. However, there are retailers in the eyewear space, like just regular glasses, and they are, to name a few, Pilestone and Enchroma. So the intended customer that we have is colorblind patients or patients experiencing color blindness. This is an optical device intended for the eye, and it heavily relies on optometry and biomaterials imaging. The FDA would classify this as a class 2 or class 3 device, depending on the type of contact lens that you would use. Regular daily use contact lenses like silicone hydrogels would be a class 2 device, whereas rigid gas permeable hard contact lenses would be a class 3 biomedical device. So how does the technology work? You can see that in the graphic on image A, there are 3 colored lines there because human color perception is a tricolor system, and the rods and cones are equipped to view blue, red, and green light. So there is the standard activation levels at a given light wavelength, which the brain then takes and perceives as color, whereas in patients with protoanomalies or deuteranomalies, they do not activate at the correct level that they should be, either activating too much or too little at a given wavelength, which impedes their ability to correctly receive color. So the rhodamine dye acts as a bandpass on certain wavelengths of light and allows your eye, or like a sensor in this case, to more accurately perceive tricolor vision. So this is a visual of the production of the contact lens and how it is applied to the patient. So you insert a blank contact lens in this dye for a set amount of time, and then when applied to the eye, as most standard contact lenses are, you have an increased ability to perceive color. So in the future, we will long-term be looking towards integrating this dye with prescription contact lenses, and we will also be working on a verification process that is not currently used by our competitors because of the the regulatory pathway that contact lenses are under that other competitors are not. And in the immediate future, we will move towards beta lens production. Thank you so much. And if you have any questions, feel free to pop into our Zoom room.